Hey, here to talk about pelvic floor today, the joy of pelvic floor exercises. Maybe you're already doing them, all over them, maybe you do them when you remember, but it's a bit of a pain, or maybe you just have not a clue where to begin. And if it's the latter, I feel you, it's quite an abstract part of the female anatomy and can seem quite elusive. We can't quite imagine it or sometimes feel it very well. So here are some exercises to bring some awareness to the pelvic floor, because I promise you it is worth giving it some attention both during your pregnancy and after you've had your baby, because not only will bringing awareness to the pelvic floor and strength and tone help your recovery after birth, but it could also help your pushing phase during your labour as well. So what exactly is the pelvic floor? Well, essentially it's an incredible 3 layers of muscles and connective tissue that include your perineum and also other muscle fibres that rise up into the pelvic cavity and kind of create this hammock, or almost like a funnel, to support your organs, namely the bladder, the uterus and the rectum, and also work to close up holes to stop any unwanted leakage or stress incontinence, which is obviously quite relevant after you've had your baby, when stress incontinence is very normal. A couple of quick facts about the pelvic floor. A tight pelvic floor does not necessarily mean a healthy pelvic floor. So simply doing like a hell of a lot of Kegels during your pregnancy won't necessarily equate to having a healthy tone in your pelvic floor. We want to learn how to relax the pelvic floor as well as tone it, because we're trying to build elasticity. Remember, your baby has to come down through this layer of muscle, so it has to soften somewhat to allow your baby to pass through. So we're looking to build that elasticity rather than simply strength. During pregnancy, there's a lot of weight bearing down on your pelvic floor from your baby and its waters, and also just gravitational pressure. So it can weaken it. And then during birth, obviously, it goes through a lot. So it's very normal after birth, as I said, to have stress incontinence. But I will say, if your pelvic floor doesn't return to a more normal feeling, or things feel rearranged a few months or beyond after your birth, then I really recommend going to see a pelvic physiotherapist just to help you heal and check out what's going on down there. So I'm going to give you a couple of exercises along with some visualizations to do with them as well. Ideally to build into a practice twice a day, once a day, but certainly a couple of times a week, helping build that tone, that elasticity that we want before and after having your baby. Okay, so all of these exercises can be done sitting over a bolster like I am, kneeling, or cross-legged, or even in a supported squat. So you could have some blocks underneath your sitting bones in a squat position, or even lying on your side as well. So I'm going to start kneeling, and I'm just going to give you a couple of ways to maybe identify the muscles around your pelvic floor if you're not so familiar with them. So the first thing we can do is actually put our thumb in our mouth, obviously make sure we've got clean hands, and then suck. And when you suck up, you might just feel something go on down there on the pelvic floor, a little lift or a little sort of vacuumy feeling. And that's because the pelvic diaphragm is connected to the actual diaphragm. And by bringing a kind of a vacuum, a suck into the mouth, we are feeling that rippling effect down in the pelvic floor. So that's one way. And then another thing I'd like you to do is take your hands, one to the back, one to the front. And we have a pubic bone or pubic joint right here. It's lower than you think. So give that a little feel, that bony part. And then at the back, at the base of your spine, near the kind of top of your bottom crack, there's your tailbone. So think about those 2 points, maybe feel them. And then take your hands underneath your bottom and feel your 2 sitting bones, your ischial tuberosities, if you want the full word. So that's your bony part of your sitting bones. Okay, so you've got those 2 points, these 2 points, and in your mind's eye now, imagine that diamond shape, okay? Those 4 points, those 4 bony points. If you feel that diamond shape in your mind's eye, and when I'm talking you through these exercises, these awareness practices, imagine that diamond shape sort of drawing together and up. And you can sometimes imagine the front and the back drawing together, sometimes the 2 sitting bones drawing together. Obviously they're fixed points, they're not actually going to move. But having that idea of the diamond shape in your mind's eye can sometimes give you a little bit of a connection to what's going on with the muscle fibers that are surrounding those areas. Okay, so there's a couple of things just to form the basis to the practice. And we are going to start with some pelvic tilts. So we'll have a natural breath, but let's just focus on a slow, long breath in first, and exhale through the mouth, allowing there to be a release through the face, through the jaw. Now there is a connection with your jaw and your pelvic floor. A soft jaw means soft pelvic floor, and the reverse is also true. So if you're tight in your jaw or tense, that often means that your pelvic floor is also tensing. So do your best to soften your jaw. And then rest your hands comfortably on your knees or on your thighs. And we're just going to begin to pelvic tilt. So we're going to rock the pelvis forwards and then draw it back. And you'll naturally probably notice that the breath wants to sort of tether itself to the movement. So maybe you're inhaling forwards and exhaling back. So rocking your pelvis forwards and back. And we're going to layer onto this a lift through the pelvic floor on the rock back, okay? So as you rock forwards, you might just relax the muscles down there, and as you rock back, begin to gather and lift and draw up through the muscles of the pelvic floor. As you rock forwards, release and soften. So imagine that diamond shape drawing together and up, and then as you rock forwards, let it relax and soften. Okay, rock back, squeeze, lift, draw up, and rock forwards, everything softens. So let the breath do what it wants to, and just continue with that little movement. And once you have a bit of awareness going on down there, and you can imagine a squeeze and a lift, then we will hold that lift as we rock back. So gather and lift, hold, keep the breath flowing, and imagine you're drawing a tissue out of a tissue box, sucking out of a straw, up, 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 up. So squeeze, gather, lift, hold. And ideally you're not feeling this really in the tummy, just in the muscles around the urethra, around the back passage, and then up a little bit higher into the deeper layers of muscle in the pelvic floor. So jaw relaxed, face relaxed, but squeezing, gathering and lifting. About 7 seconds, and then we're going to release. And the idea is to release and soften for a full 7 seconds as well, even a bit longer. So if we're just strengthening and toning and squeezing and not relaxing, we're not building that elasticity that we want in the pelvic floor. We're not achieving that tone, we're just achieving strength. So relax and soften, and make sure you stay relaxed for a full 7 to 10 breaths or seconds, matching the length of time that you were engaging for. Okay, so that is the gentle pelvic tilt, very straightforward, and it's just quite a nice one to do as you rock back to squeeze. And once you become more familiar, you can actually exhale on the squeeze up and then inhale on the release, and tether it more to your breath, which can be a nice thing to do for a conscious breath practice as well. Okay, so this exercise is working a bit more with the superficial layer of muscle, not so much with the deeper layer. So the muscles that are around the back passage, the anus, and around the urethra. So you might imagine that you're stopping yourself from doing a wee, or stopping yourself from breaking wind. Those are two quite common cues to start to sort of feel into that layer of muscle, that skin layer of muscle. And we're going to be doing more of a quick squeeze and release. Squeeze and release. So as you do this, and you can continue doing it as I'm talking now, or you can just get a little bit more familiar before we begin, you can imagine a coral kind of drawing all of its beautiful flowery bits in, and then imagine the coral sort of opening and flaring out, and then coming back in. Okay, so you've seen those nature docs, David Attenborough, beautiful, colourful coral, and then something comes up and it goes squeeze in, and then release out. A clamshell opening, then drawing in, and then releasing. So try and engage those muscles, holding in a wee, stopping yourself from breaking wind, and then releasing them. And just go with that action, just as we're talking, as we're breathing. Soft face, soft jaw, squeeze and release. Squeeze and release. So it's a gentle toning rather than a desperate hardening, and then a release. And we're looking to do this, let's say 10 or 15 times. And then we release fully and relax for, again, a good 15 breaths or 10 breaths, just making sure that you're matching the amount of time you're engaging with a relaxation through the pelvic floor as well. Check in with the rest of the body, and then look to do that exercise again, maybe 2 or even 3 more times, just adding it into your practice when you remember throughout your day or throughout your week. Okay, so the last awareness practice is my favorite, if you can have a favorite pelvic floor exercise. And we are working on a much deeper level now. So we're not just skin deep, we're going to go up into the muscles that rise up into the pelvic cavity. And I will say, as a caveat here, please don't worry if you're not feeling a huge amount. And if I'm talking about sort of bringing the awareness up and up and up and you're not really feeling it, that's very normal. And like any exercise, it just takes practice. So just keep building it into your practice, and eventually you'll begin to identify that slightly deeper layer of muscle that rises up into the pelvis. So it's called the staircase, sometimes the elevator exercise. And we're just going to begin by relaxing. Okay, so relaxing the pelvic floor, and again, finding a comfortable position to sit in or to lie in. Nice, slow, full breaths, soft jaw, soft face. And we're going to breathe naturally and normally here, and not worry too much about matching the breath to any kind of movement. And instead, just staying with a slow breath and starting to engage the first layer of muscle that you can feel in your pelvic floor. So that layer we were just working with when we were squeezing. We're going to gather and lift and then hold. Okay, so probably engaging about a third of the way up, if you like. And then keep your breath flowing. When you're ready, gather and lift a third more. So rising up a little bit into the pelvic cavity. And you can imagine you're maybe trying to squeeze a sponge in your vagina. Hold. And then engage upwards even more, as high as you can go. And almost imagine that you're holding this engagement high on a platform in your pelvic cavity. Don't hold your breath, but keep that gathering, keep that holding, that squeezing sensation of a sponge gently in the vagina and slightly lifting up. And then as we release, we're going to come down in the same way. So release a third of the amount and keep breathing. And then a second third. And then eventually relax the whole pelvic floor. And just take a moment to fully release. Again, remembering that if you weren't feeling what I'm talking about, it's nothing to worry about. And just do your best to keep this idea of these 3 layers working, and you're building this lifting as we go up. So we're going to do it again. So nice slow breath, relax the shoulders. And when you're ready, starting to gather and lift that first layer of muscle, that layer that's more skin deep. Come back to that diamond shape, that's gathering and drawing together, lifting up, hold on a platform. And then lift a third more, layering up into the pelvic cavity, hold, breathe. And then finally, your full capacity, your full gather and lifting, like you're squeezing a sponge in your vagina, gathering and lifting everything up. You might even feel your lower abdominal wall working a little bit as well. Keep that lift, keep that gentle tone. And then as you release, don't just release all at one time. Release a little bit, like a third. And then a little bit more. And then you're fully softening down through the pelvic floor and relaxing and breathing. So I'd recommend doing that one more time, maybe 2 or 3 if you have the time, and building that into your practice as well. So we've really worked on all the different fibers of the pelvic floor. We've done something very straightforward: pelvic tilt, lift on the backward tilt, release on the forward tilt, gentle squeeze and releases to work on the superficial layer of muscle, and then working with this much more sort of advanced and deeper layer with the staircase practice as well. So those are my 3 straightforward exercises. If you have any comments or questions, feel free to contact me. Hit subscribe on these videos if you're enjoying the content, and I look forward to seeing you next time.